Welcome, everyone, tuning in right now from the different parts of the world. This is the third installment of the World Council of Churches Perspectives from the Margins webinar series. I am Joy Eva Bohol, Program Executive for Youth Engagement in the Ecumenical Movement. More than 20% of the 1 million lives who died of COVID 19 are frontline essential workers. This raises concerns about unsafe working conditions, low pay, long hours, and violence against medical and essential workers in some countries. Today, we will listen to the voices from the front lines in this webinar series entitled People at the Front Lines: The Gift of Life. Our moderator today is Lani Anaya, a young woman leader from Mexico. She is a member of the Methodist Church of Mexico. Lani holds a Bachelor of Arts in International Relations from the National Autonomous University of Mexico. She also holds a master's degree in Peace and Conflict Studies from Uppsala University. She began her ecumenical studies at Bose Ecumenical Institute and continues now as a master's student at Bonn University. Lani is Senior Analyst for Peace and Sustainable Development Projects at OAM, a Danish consultancy that works for the United Nations, the African Union, and the World Bank. In Mexico, she is the Institutional Development Coordinator of the Action for SDGs program with My World Mexico. She is a professor of ecumenical studies at the Theological Community of Mexico. Lani coordinates the research department at the Latin American youth-led network Juventudes por la Paz, or Youth for Peace, and writes about international and peace analysis with relevant Mexican media. Lead us from here, Lani.
Thank you very much, Joy, and good morning, good afternoon, and good evening, wherever you are right now in the world. And I'm really honored to moderate this webinar from the World Council of Churches, which is part of the Perspectives from the Margin series, People at the Front Lines, the Gifts of Life. The pandemic that we are experiencing now has resulted in global pandemic costing lives and realizing a series of precautions, including Things like lockdowns, physical distancing, and the closure of business. The impact that coronavirus is having cannot be entirely calculated at this time, and therefore is affecting us in different ways. Notwithstanding these challenges, I'm sure we can find hope of examples of faith and engagement of committed actors who are working in the front lines and are offering support during these times. So today we have some really interesting speakers that will talk about their challenges prior and during the pandemic, their key learnings, their insights, their practices, and a message of hope to our church. How the faith communities across the world can learn to better respond to crisis and build back better. And addressing also the global roadmap of leaving no one behind in all this strategy. We have with us the Reverend uh, Neki Soriano from the United Methodist Church in Philippines, Ms. Deacons from the Arcot Lutheran Church in India, and Alex Gupiri, who is the Forum Coordinator of ACT Alliance from South Sudan. I will introduce each one of the speakers. Each one of them will talk about their experience in the front lines and how they are addressing COVID-19 related challenges. Please, if you have any questions during this conversation, you are most welcome to post them on chat. And after the participants will talk about their experiences, we will take those questions so they can answer them into our Q&A session. So we'll introduce our first speaker, Dr. Neki Soriano or Nessa Soriano. He's pastor and missionary doctor working on prevention and community health. Uh, Dr. Nestor Soriano has studied a bachelor degree in biology from the University of Philippines, and he has a medical degree at West Visayas State University. He holds a Master of Divinity at Duke University and a diploma in international health at the University of Philippines. I know you are addressed as Doc, and so welcome, Doc Soriano, and the floor is yours.
Thank you, Lani. Good morning, good afternoon, and good evening to all our listeners and our viewers. I am Neki Soriano. I am a pastor and a doctor at the same time. I am happy to be able to be one of your speakers this afternoon and share to you the good news. In my work as a doctor, I often tell the bad news to my patients that they are sick. Now I am grateful for the opportunity with the World Council of Churches to share with you the good news from God. Next slide, please. This will be the content of my talk, which has 5 parts. So let me begin by describing what does it mean to be a frontliner during this pandemic. As a frontliner and a healthcare worker in the hospital, we have the unique experience of seeing firsthand patients suffering from COVID-19 and their family who have fears and despairs with the uncertainty of the disease. People who are sick go in the hospital because they are hoping to be healed. Relatives are worried on what the future will bring for their loved ones and for their family. They are all hoping. People are looking for hope. They go in the hospital looking for hope. And as frontliners, we must be able to bring a message of hope and peace. We must share the good news of hope, even if we ourselves have to conquer our own fears. That is what it means to be a frontliner. I am reminded of Deuteronomy 31, verse 8. This message of hope was given to the frontliner, Joshua, as he leads his people to face challenges in their journey to Canaan. The Lord Himself goes before you and will be with you. He will never leave you nor forsake you. Do not be afraid. Do not be discouraged. This is the same promise we hold on to as frontliners. We must trust God even as we put ourselves at risk to be infected. We must not feel alone even as we leave our families to help the sick. And we must not be afraid as we sacrifice ourselves for the sake of others. Next slide. We encounter a lot of challenges as a frontliner. We have human rights that are often neglected. First, our right to life is being threatened with the discrimination frontliners encounter from the general public. Some of my nurses were even asked to leave their dormitories and boarding house because the landowners fear they might infect the other tenants. People stigmatize and even assault frontliners. In fact, one frontliner almost became blind because a group of people ganged up on him and splattered bleach on his face, fearing he was infected with COVID 19. Another is our right to health is also neglected. We are already at risk by providing service directly to people with COVID 19. But that risk increases when we do not have access to appropriate personal protective equipment. The inequity of not having access to life saving materials and protective equipment makes me feel like a sitting duck just waiting for COVID 19 virus to infect me. The lack of human resource also puts the health of frontliners at risk as fatigue lowers our immunity. My nurses usually go in 12 hours duty to save on the use of PPE, and also because we don't have enough human resource, making them more susceptible to infection. In fact, in some provinces like Davao City in the southern part of Philippines, as high as four out of 25 health workers become infected. The health workers have consistently called for the government to respect our right to health by protecting us from unnecessary risk while providing us with appropriate benefits. Another challenge that we encounter is freedom of movement. Because of the lockdown, although the lockdown is a practical and necessary public health intervention to slow down the virus, but the excessive restrictions of movement make it difficult for health workers and frontliners to go on duty. The lack of public transport makes it even more difficult for us to travel from our home to the hospital. Lockdowns must be implemented for public health purposes. It must be appropriate, proportionate, and not discriminatory. Access to resources for testing and tracing can help mitigate indiscriminate restrictions. The problem of accessibility has greatly increased the inequity we as frontliners in a low to middle income country experience. Next slide. You know, this pandemic has exposed the inequity among nations. The truth is, not all frontliners are protected in the same way. Such inequity has increased the risk and impact of infection to the women and young frontliners, to the most vulnerable. Although the pandemic affects everyone, even state leaders are not spared by the COVID-19 virus. Some of these leaders may downplay the virus and choose not to wear their mask, even if they have access to these effective personal protective materials. However, the most vulnerable members of society do not enjoy the same access to preventive equipment like the mask. The rich and powerful can survive COVID 19, but the vulnerable people, the women, the young frontliners, they may not survive. This pandemic has increased the incidence of domestic violence, increased the burden for women workers, like young mothers leaving their children and their family so that they could go in duty. Also, young workers are treated as dispensable. Thus, issues of lack of equipment uh, or the unavailable PPE for them is neglected, putting them at greater health risk. Even if these vulnerable frontliners want to wear a mask, it is not readily available to them. Their safety is at a higher risk. Next slide, please. Let me emphasize a little more the importance of the PPE for frontliners, especially the appropriate wearing of masks. Our first positive COVID 19 case in the hospital did not wear masks properly. We were both exposed in the same environment, but she was the one infected. That was way back in March. In the hospital, we did not have enough PPE, so we had to improvise. Sometimes we even had to reuse supposed to be disposable masks and equipments. But the lack of PPE is just one problem. We do not have access to proper equipments like testing machines. Just last month, I got exposed to a person with COVID 19. He did not know that he was infected because the results of his test came in late. We had to wait 3 to 5 days because the test needs to be sent to Manila, which is 8 hours from our place. I was exposed on a Monday morning. But I had to wait for my turn to be tested on Thursday. That's 4 days waiting. By that time, I was already having fever and was showing signs of COVID 19. I got infected and became a patient. Less people would have been exposed if the results would have been faster, if the tests were available at us. Less people would have been infected if we have proper equipment and all of us can wear a mask. Wearing a mask is respecting other people's right to life and health. Next slide. Everyone is affected by this pandemic. Thus, everyone should do something, including the church. The church can play a big role if we act as one body of Christ. When Jesus came, he came to give life, an abundant life. The Greek word for life that was used in John chapter 10 verse 10 means Zoe, which means the life that belongs to God or becoming holy, becoming whole or having wholeness. The other word for wholeness is health or what we understand better as shalom. Health is shalom. The church is called to be a steward of that health, of that shalom. In this time of the pandemic, the church must be able to offer shalom to people. And offering shalom may mean taking care of other people's need. That may mean providing food packs to the hungry, shelter to the homeless, or even bicycles to our frontliners so they could travel. An abundant life is caring for the least, the last, and the lost. Next slide. The church is also called to be advocates. Shalom or health can only happen by creating an environment in which health can thrive. This suitable condition is a joint responsibility of the public and the private sector. The church must work with other stakeholders towards creating a space for people to live an abundant life. The verse in Ezekiel 34 reminds that the church must point out to our leaders in the society, in the community, to care for the weak, the most vulnerable members of society. This includes advocacy for international cooperation among different nations to achieve equity and access to life saving supplies, to build the capacity of weaker states, and emphasize the universal health care to provide access to all people, health for all, just as Jesus made healing available to the sick, the poor, and the marginalized. Next slide. In closing, I would like to share a hopeful message with the members of the fellowship. There is a pandemic right now, yes. There is sickness, there is sadness, there is fear and despair all around. We do not only see that in this hospital, but even in the community that we live. Families are hurting, scared, anxious, and uncertain of the future. But there is a balm in Gilead that will heal our sin-sick soul. There is a balm in Gilead, and God will heal us. God will heal this broken world. This pandemic and all the challenges that comes with it will come to an end because there is hope in God. So let us not stop worshiping God. Let us sing songs of praise, have virtual fellowship, read the Bible, and pray together with others and pray for each other. Pray also for the frontliners. Next slide. The frontliners are instrument of God's healing. But we as Christians are the frontliners in bringing the good news of hope in this broken world. Keep safe. Thank you and God bless.
Thank you, Pastor. And just for now, I will ask one question about. You pointed out that yeah, in fact, the COVID-19 is impacting everyone. However, it's not affecting us equally, and that's one of the main reasons that we are talking today. Um, and in your perspective, eh, what's happening in your church, or because you talk about the hospital, but what's the intersection between the work you do in church right now and the work in the hospital? Is there any link now between those two, or bridge from the church and your work as a frontliner in the medical services?
Yes, the church right now, thankfully, is able to witness to the love of God especially those to the most vulnerable members of the society. The hospitals, especially the government hospitals, are trying their best to be able also to cater and provide services, especially to the most needy, to the indigenous people, to the poor people, and those who have not enough resources to be able to access the private hospitals. Uh, and the good thing is that they could work together. They could work together. They're helping each other. They're complementing each other in their service. And especially in this country, we try our best to maximize whatever resources we have. And that is what we are calling for, that people will help those who are most in need and be able to share what they have, especially with the lack of resources that we have here in our country, here in the Philippines.
Thank you so much, Pastor. And yes, I think this is an invitation to begin reflecting by the time we have the questions and answer how our churches can begin working together with the frontliners of this pandemic, as you have pointed out. And thank you so much for your intervention. And I'll pass now to introduce Mrs. Deacon. And as we have seen with the testimony of Pastor Neki, there is a sacrificial work that health workers, that sanitary people service are doing in the midst of the pandemic. And then therefore we have to translate this as solidarity, as mutual support and empathy among these stereotypes that might be coming, as you pointed out, Pastor Neki. And Mrs. Dickens, our next speaker, she is a person who works in the sanitation service at her municipality in Tiruvannamalai in southern India, and she recently experienced, because she's working at the sanitation service cleaning the streets, a very dangerous accident while she was cleaning, a bottle of acid of these chemicals that she has to use for cleaning exploded on her face, and she also had to stay some days at the hospital. During this pandemic, the sanitation workers have to use stronger cleaning chemicals to disinfect things. And Mrs. Eacon's testimony is also really interesting. She belongs to the Arcot Lutheran Church, and she was forced to get married when she was really young. Her husband was an alcoholic person, and when he passed away, she had to begin working as a domestic worker to rise up her sons. So she was working for 20 years in this task, and after many life struggles, she found a promising job as sanitation worker in her municipality, where she has been working since 2019. And due to her work task, Mrs. Deacon cannot join us live today. However, we can see a recording from her, and we really and deeply appreciate Shekinah Penita and Adam Johans Peter from the Arcot Lutheran Church for recording this and letting us know her testimony from a frontliner and from the sanitation service. So we can play the video.
என் பேர் டீஃபென்ஸு சாரன் சபத்தெருவிலேருந்து வரேன் வேலைக்கு. வேலை செய்யறதே கஷ்டம், பெருக்கிறது கஷ்டம், டெய்லி துடைக்கிறது கஷ்டம். அதை காட்டிலும் துடைச்சிட்டு இருக்கும் போதே போய் டீ வாங்கிட்டு வாங்குவாங்க. டீ வாங்கிட்டு வந்து கொடுக்குறதுலே இந்த குடிச்ச கிளாஸை கழுவுங்கன்னு சொல்லுவாங்க. கிளாஸை கழுவணும், அது கொஞ்சம் டைம் ஆயிடுச்சுன்னா திட்டுவாங்க. ஏன் சார் ஒரு ரூம் பெருக்கிட்டு தானே வர முடியும், அதுக்குள்ளேயே நீங்கள் வந்து திட்டுறீங்க, திட்டாதீங்க சார், ப்ளீஸ் சார், வேலை செய்கிறேன் சார், எங்களை ஒன்றும் சொல்லாதீங்க சார், நீங்கள் என்ன சொன்னாலும் நாங்கள் கேட்போம் சார், திட்டாதீங்க அப்படின்னு சொல்லுவோம். கரெக்டாக 11 மணி ஆகிட்டா நாங்கள் கையெழுத்து போட போகணும் சார், டைம் ஆகிடுச்சு, எங்களை அனுப்புங்க அப்படின்னா, நீங்கள் முடிச்சுட்டு போங்கம்மா வேலையை அப்படின்பாங்க. அது வேலையை முடிச்சுட்டு தான் நாங்கள் வர முடியும், வேறு ஒன்றும் சொல்ல முடியாது அவங்கக்கிட்ட. கொரோனா வந்ததுலேருந்து டெய்லி துடைக்கணும், ஒரு நாள் கூட துடைக்காமல் இருக்கக்கூடாது, துடைக்கணும். அதே நேரத்தில் ஆஃபீஸில் யாருக்குன்னா கொரோனா வந்துருச்சுன்னா அந்த டேபிள்லேருந்து கம்ப்யூட்டர்லேருந்து அவங்க பண்ணுற ஃபோன்லேருந்து அவங்க எழுதுகிற பேனாவிலேருந்து எல்லாமே அந்த மருந்து போட்டு துடைக்கணும். இதை காட்டிலும் கஷ்டம் வேறு எதுவுமே கஷ்டம் கிடையாது. அதுதான் ரொம்ப கஷ்டம். ஆம்பளை செய்யறது பொம்பளை செய்யறது ஒரே வேலை தான். இருந்தாலும் தனியாக இருக்க தனி வேலைன்றதுனால எங்களுக்கு அவங்களுக்கு ஒரு கஷ்டம் இல்லை. எல்லாம் ஒரே வேலை தான். சர்ச்சில் கொடுத்தது வந்து சபையார் வாங்கினாங்க. ஆனால் வந்து எனக்கு அந்த டைம் இல்லை, நான் வாங்கலை. சர்ச்சில் கொடுத்த ஒரே ஒரு உதவி, ஒரே தடவை ஒரு அரிசி பருப்பு கொடுத்ததை வாங்கினேன். மிச்சம் எல்லாம் எனக்கு ஜேபி ஐயா தான் கொடுத்தது. உதவி செஞ்சது எல்லாமே எனக்கு ஜேபி ஐயா தான். வேறு எந்த சர்ச்சில் கொடுப்பாங்கன்னு நான் எதிர்பார்க்கல. எதிர்பார்த்தாலும் அந்த வாங்குறதுக்கு எனக்கு டைம் இல்லை. எனக்கு இந்த 6 மாத காலமாக எனக்கு நம்பிக்கை கர்த்தர் மேலே தான் நம்பிக்கை. தாய் தகப்பன் சொந்தக்காரர் யார் மேலேயும் நம்பிக்கை கிடையாது. முதலாவது கர்த்தர் மேலே நம்பிக்கை. ரெண்டாவது ஆஃபீஸில் சொல்லுவேன், சார் எனக்கு நீங்கள் முதலாவது கர்த்தர் இருக்கிறாரு, எனக்கு எல்லாமே நல்லதை செய்கிறவர் எங்கள் அப்பா தான், ஏசப்பா தான். ரெண்டாவது நீங்கள். இப்போ இந்த கொரோனா காலத்தில் இந்த மாதிரி மருந்து அடித்தது கூட, என் முகத்தில் மருந்து அடித்தது கூட முதலாவது கர்த்தரை நான் மனசுக்குள்ளே நேசிக்கிறதுனால என்னை மறுபடியும் உயிர் கொடுத்துருக்கிறாரு. உங்களுடைய ரெண்டாவது வந்து உங்களுடைய ஆஃபீஸில் உள்ள அன்புனால இன்னைக்கு நான் மறுபடியும் செத்து புடைச்சி மறுபடியும் ஆஃபீஸில் வந்து நான் கால் வச்சுருக்கேன்னா முதலாவது கர்த்தர், ரெண்டாவது நீங்கள். எனக்கு இது போதும் சார், என்னால் முடிகிற வரைக்கும் இந்த வேலை செய்கிறேன், முடியலன்னா நானே சொல்லிட்டு நின்றுடுறேன் அப்படின்னு சொன்னாங்க. தான் கர்த்தரை தேடினா ஒரு குறையும் வராது நம்மளுக்கு. நான் முழுசாக கர்த்தரை தான் நம்பியிருக்கேன், வேறு யாருமே நம்பலை. டைம் தெரியாமல் 3 மணிக்கு எழுந்திருப்பேன், திரும்ப படுத்துருவேன். டைம் ஆகலைன்னு திரும்ப படுத்துருவேன். 4 மணிக்கு எழுந்திருப்பேன். எழுந்திரிச்சு ஒரு 10 குடம் தண்ணி எடுப்பேன். தண்ணி எடுத்துகிட்டு குளிச்சுட்டு ஒரு ரெடி ஆவேன். மணி 5 ஆகிடும். சர்ச்சில் பெல் அடிப்பாங்க, வசனத்தை சொல்லும். வசனம் முடிஞ்சதும் பாட்டு பாடுவாங்க. பாட்டு முடிஞ்சதும் அந்த பிரசங்கத்தை கேட்டுட்டு ஸ்தோத்திர பலி புக்கு 1000 ஸ்தோத்திர பலி புக்கை படிச்சுட்டு ஒரு பக்கம் படிச்சுட்டு அப்படியே நடந்து வருவேன். நடந்து வந்து ஆஃபீஸில் இங்கே மச்சி கையெழுத்து போடுற இடம் மச்சின்னு சொல்லுவாங்க, அந்த இடத்துல கையெழுத்து போட்டு கைரேகை வச்சுட்டு ஃபோட்டோ பிடிச்சிட்டு ஆஃபீஸ் சாவி கொடுப்பாங்க, அதை வாங்கிட்டு போவேன். வாங்கிட்டு போனது முன்னாடி என்ட்ரன்ஸ்லேருந்து ரோடு வரைக்கும் ஒரு 1/2 கிலோமீட்டர் இருக்கும். சுத்தமாக பெருக்குவோம். சாணியெலாம் நிறையா போட்டிருக்கும். மாடு சுத்தமாக பெருக்கிட்டு ஆஃபீஸ்க்குள்ளே போவோம். ஒவ்வொரு ரூமையும் பெருக்கி மாப் போடுவோம். ஒவ்வொரு ரூமையும் பெருக்கி மாப் போட்டு கீழே ஒரு 13 ரூமு, மேலே 12 ரூமு மாப் போட்டு அவங்க காப்பி குடிச்சிட்டு கிளாஸ் வச்சுருந்தாங்கன்னா அந்த கிளாஸை கழுவோம். லெட்டினில் யாருன்னா இருந்துட்டாங்கன்னா அந்த லெட்டினை கழுவணும். ப்ளீச்சிங் பவுட்ரு போடுவாங்க. ப்ளீச்சிங் பவுட்ரு போட்டால் நெடி ஏறும். எனக்கு அது ஒத்துக்காது. சில நேரத்தில் கஷ்டமாக இருக்கும். ஏசப்பா எனக்கு எதுக்கு இவ்வளோ கஷ்டமாக இருக்குது, என்னால் வேலை செய்ய முடியல. அந்த பவுட்ரு ஒத்துக்க மாட்டேங்குது, பெனாயில் ஒத்துக்க மாட்டேங்குது. இருந்தாலும் ஜென்ஸு போடாத லேடிஸு போடுறதுனால நாங்கள் தான் செய்ய வேண்டியது இருந்துச்சு. கொரோனாவுக்கு முன்னாடி கக்கூஸ் பாத்ரூம்லாம் கூட கழுவணும். கொரோனா வந்த பிறகு ஒரு ஜென்ஸை போட்டாங்க. அவங்க போட்ட பிறகு கொஞ்சம் பரவாயில்லாமல் இருந்துச்சு. அப்பயும் ஒவ்வொரு ரூமில் மருந்து போட்டு அதை துடைக்க சொல்லுவாங்க. மாப் போடுவோம். மாப் போட்ட பிறகு மறுபடியும் கம்ப்யூட்டர்லாம் துடையணுவாங்க. மறுபடியும் துடைப்போம். துடைச்சிட்டு மணி 11 மணிக்கெல்லாம் துடைச்சிட்டு மறுபடியும் வருவோம் கையெழுத்து போட. கைரேகை வச்சுட்டு ஃபோட்டோ பிடிச்சிட்டு மறுபடியும் 2 மணிக்கு வரணும். மறுபடியும் வீட்டுக்கு நடந்தே போகணும். அவ்வளோ தூரம் நடந்து போயிட்டு திரும்பவும் வரணும். திரும்ப மதியம் 2 மணிக்கு வருவோம். 2 மணிக்கு வந்துட்டு கையெழுத்து போட்டு திரும்ப ஆஃபீஸுக்கு நடந்து போகணும். மதியமும் காலையில் செஞ்ச வேலையை மறுபடியும் மதியம் அந்த வேலை செய்யணும். மதியம் கஷ்டமாக இருக்கும். வெயிலில் பில்லு பிடுங்கணும். மாடு வந்தால் மாடு ஓட்டணும். ரோட்டில் குப்பை வந்துச்சுன்னா குப்பையை பெருக்க சொல்லுவாங்க. குப்பை அள்ளுவோம். கரெக்டாக மணி 4:30 ஆகிடும். திரும்ப அவ்வளோ தூரம் நடந்து வருவோம். நடந்து வந்து கையெழுத்து போட்டு ஃபோட்டோ பிடிச்சிட்டு மறுபடியும் நடந்து வீட்டுக்கு போகணும். போயிட்டு வீட்டில் போயிட்டு வாசல் பெருக்குவேன். எதனா பில்லு இருந்தால் பிடுங்குவேன். ஒரு 10 குடம் தண்ணி எடுப்பேன். செடிங்களுக்கு தண்ணி ஊற்றுவேன். குளிப்பேன். மணி 7:30 ஆகிடும். 8 மணிக்கு படுப்பேன். திரும்பவும் காலையில் அதே டயத்துக்கு எழுந்திருப்பேன்.
We appreciate so much the testimony of Mrs. Deacons, and as we can see, is not only health workers but also sanitation personnel who are facing struggles during this pandemic. And as we try to keep places clean and disinfected, that also place people into danger and risking their own health. So we really appreciate these testimonies from the front lines, and that and the show from Past Talk and from Mrs. Deacon, uh, amidst all these difficulties, how faith plays a huge role in our life as people of God, and then how do we reflect that light to others. Um, and our last, not least, speaker is Alex Gupiri. Alex is from South Sudan and he works with ACT Alliance Forum as coordinator. He holds a MBA from Uganda Christian University and a bachelor from Makerere University at Kampala. His experience involves work with the ACT Alliance by coordinating, establishing, and building partnerships with ACT Network members, NGOs, and international organizations. He has worked with the Lutheran World Federation, the Jesuit Refugee Service in coordination, management, and education task. And he has been a frontliner in this moment from the pandemic as um, a person who works for emergency preparedness and humanitarian response. So, Alex, the floor is yours.
Thank you, Lani, and everyone for taking part in this webinar. I'll request Marcelo to share the screen. Uh, this webinar, COVID-19 Perspectives, People at the Front Line, the Gift of Life, is coming in at a meaningful time where all the world globally is really undergoing difficult times. Next. In Africa, the situation update for the WHO African region as of 21st October 2020 indicates that Africa already has about 1.2 confirmed cases of COVID-19 and over 28,000 fatalities. Next. Next. Go to the first page, introduction. The COVID-19 global pandemic is currently causing unprecedented disruption to daily and working life, triggering strong feelings of uncertainty, stress, and anxiety in almost everybody. We are currently living in a global public health crisis, which is moving at a speed and scale never witnessed in living generations. In Africa, COVID-19 is upending livelihoods, damaging businesses, and threatening to revise sub-Saharan African development gains and growth perspectives for years to come. The continent is also set to experience its first increase in the proportion of people in extreme poverty in decades, with the informal sector as a major source of income and employment, one of the hardest hit COVID pandemic in Africa. Next. Fragile and conflict-affected states in Africa, to mention South Sudan, Central African Republic, Democratic Republic of Congo, Somalia, and many other sub-Saharan African countries are expected to be hit particularly harder with COVID-19 and its negative impact. Additionally, while governments across Africa reacted quickly, putting in place vital measures to try and slow the rate of infection, many issues still present significant rise, including poor access to safe water and sanitation facilities and fragile health systems, which have been witnessed particularly in countries like South Sudan, where the health system is found to be weak during this difficult time. Next. Humanitarian frontliners in South Sudan are also facing similar issues as frontliners and other caregivers and so forth. Next. When we talk about frontliners, of course, as mentioned or seen before in our earlier video, frontliners are doctors, nurses, caregivers treating and caring for COVID-19 patients. Frontliners are also humanitarian workers, field workers, delivering services to the people and communities affected by COVID-19 pandemic. This is what, if people feel very stressed, but also feel that others genuinely care about them, that will make the stress easier to bear, and the experience of traumatic event reduces over time. Indeed, as frontliners of performing different functions, this is the comfort that people need globally to ensure that the support is there to be provided by frontliners and to help those who need the services. Humanitarian frontliners offer services to people about how they support themselves and promote resilience and well-being during the difficult times of COVID-19 pandemic. Next. Being a frontliner means putting people's life before your own, meaning putting people first. And the people we put first are those who are really in need of our support services. Being a frontliner means working tirelessly in an unimaginable condition to save lives. It means timely communicating factual information in accessible format. During this time of COVID-19, especially most African countries, there have been issues or challenges of misinformation and through social media platform, which actually also triggered a lot of fear and anxieties among communities. Being there with the communities providing social support is one of the key roles of frontliners to provide. And observing and providing guidance on COVID-19 measures, especially communities that are deeply rooted in rural areas, needed the support of frontliners to ensure they integrate properly the COVID-19 measures that have been streamlined by WHO and the relevant Ministry of Health in different countries. It is also the role of frontliners to deliver services and clearing expectations from the communities or people who are going through this kind of difficult situation. Frontliners are at risk and have to do risk mitigations through use of standard operating procedures and also ensuring that personal protective equipments are taken as priority. Next. As frontliners of performing different functions, we have been challenged by different constraints as frontliners. And some of these challenges are: one, challenge of enforcing social distancing. It has been observed in most of the areas that we operate, delivering humanitarian work or services to people, communities affected by COVID-19 in a way that it is in Africa, the social norms are distinct and they are different in ensuring that somebody to observe 1 meter social distancing is really a huge challenge. And this has been also a common scenario in Africa. Yet social distancing has been proven to be one of the most effective way of avoiding or mitigating COVID-19 infection. As developing country, the African continent has also been struggling with the weak economy and different country policies through shortage of personal protective equipment, which has exposed most frontliners to more danger than expected. And also in relation to interacting, when we start witnessing COVID-19 in Africa, the news came with a lot of fear and anxiety. So this has continued affecting, impacting the normal working aspect of COVID frontliners in terms of handling COVID-19 scenarios. There's also challenge of fulfilling social shielding responsibility. This is a protection and support that is normally offered to most vulnerable people. This has become one of the key challenge to ensuring that how we can ensure safety of people in terms of getting exposed or to infections or local or community transmission being overemphasized over and over, and also a kind of like communities thinking of we as frontliners giving more care and support in a very highly expected manner. During this time of COVID-19, there have been some work schedules where staff, non-essential staff have been moving from home to create at least an office space. So we realized in delivering our humanitarian work to communities and people affected by COVID-19, we organized a strain where there's shortage of staffing to do the normal work that we do. One of the key challenges faced by frontliners in Africa, and I believe in most part of the world globally, is the issue of stigmatization, where many people even tend to hide their signs and symptoms of COVID-19 because the community will perceive them with a lot of fear and so forth. And this has also has led to discrimination among the communities. One thing is that in South Sudan, when we first got the first case of COVID-19 on the 5th of April 2020, a UN staff was diagnosed to have COVID-19 positive case. And this
Alex. Hi, thanks. We need to begin wrapping up. So maybe you can begin wrapping up telling us about how humanitarian workers in shortage they serve their communities and what kinds of shortage are you experiencing at the moment?
Yes, humanitarian workers actually working with the communities, of course, means we have to create new approaches on how to engage with them and ensuring that we observe all the COVID-19 measures. And this was done in a way that, of course, we had first to create awareness among the communities and working with the churches, structures on the ground, and putting them that kind of information that we ensure social distancing is practiced, and when we are delivering services, humanitarian services, we have to first observe that and also distribute face masks to the community and hand washing facilities with soap and so forth. Yeah. Next. Women and young frontliners also are at a vulnerable situation in this time of COVID-19. This is because they are exposed to a high risk due to lack of experience and also probably no personal protective equipment. Stress and mental health problem has been also been recognized to be directly affecting women and young frontliners. Stigmatization at the same time has been faced by this group of people, including social disconnects where people are not able now to interact in some other lively activities or some social functions. And because women and young frontliners are giving direct care and support to COVID-19 patients, this has also impacted them negatively on the loss of income because they will not be able to engage in livelihood support. Next. The church itself has played a key role, especially the South Sudan Council of Churches has a COVID-19 task force, and where they actually engage with advocacy and communication through media advocacy, disseminating evidence-based information that actually clarify most of the mixed information through social media. The church has also been giving community support and basic service delivery through distribution of PPE and medicines and other services. Pastoral services, prayers of hope and guidance, counseling. We have trauma healing toll-free number, quadruple tool where people can call to get some of the support, especially those who are isolated through self-quarantine and also those who may be having some symptoms of COVID-19 and they have the fear to deliver work. Next. The key lessons learned is that COVID-19 is real and it kills. COVID-19 does not discriminate or need to have also methodologies or approaches that needs to be thought out. We should not take things for granted. We know COVID-19 has brought a lot of changes and these changes takes time. It is also clearly and it's also clear that change might not stay easily to easily go. People can easily go back to old habits. It has not been easy to practice some of the measures of COVID-19 because of our cultural norms and so forth, and this has been challenging somehow. Mental health support is crucial because most people have been having mental distress, which actually we need, as a church, we need to together give that support and also some people who have knowledge of mental health and also support. Next. Hopeful messages, prayers, and hope. It helps a lot. Care and love is very important. Mental health support, social and economic support, effective communication and factual information sharing, and the assurance that COVID-19 will one day come to an end. Thank you very much for taking part in this webinar.
Thank you so much, Alex, and for addressing all these challenges from COVID frontliners. And we will have one question from the audience, and whoever wants can reply to this. How can we ensure that these sisters and brothers are also protected and remunerated to have dignified lives? All these people who have we have talked about, all these frontliners.
It's a question for me. Yes. Brothers and sisters can be protected and have dignified life because one is that we first have to put their life above everything, our own life. And this means that mostly people, we need to emphasize that most people who go as frontliners have the most protection in terms of PPEs in place and also ensuring some better standard operating procedures in first encountering facing people who we support as frontliners. Because one main thing is I mentioned, we need not to relax also with our own life, and that's why I say we should not take things for granted. As earlier on mentioned, about almost 1.2 million people who died of COVID-19 from health workers, and this sometimes happen because of certain level of limited personal protective equipment, and also a level of negligence at the same time. So once we ensure that we are really at a high risk, I mentioned before that we need to first mitigate the risk, and also considering that our safety is a personal responsibility first, and we have to use some of these protocols and approach situations with precautionary measures as we deliver this support as frontliners, because our safety comes first.
Thank you, Alex.
Yes.
Yes, Nick.
Yes, I would like to emphasize what Alex said. And the important part there is that we must be able to create the environment where our brothers and sisters in the sanitation department are able to be protect themselves and be protected and be given proper remuneration. And the church has a big role in advocating the government to ensure that safety of these people are being protected. The church, as I've said, I mentioned about the verse in Ezekiel 34. The church can advocate, remind, tell, ask the government and other stakeholders to be able to ensure that these people are being protected as they do their work. We could provide them. We could uh, donate some PPEs, but the remuneration, if they are hired by the government, by the uh, local units, then they should be able to provide humane compensation for these people. And if we do not provide that proper environment, proper social, if we are not able to address the social indicators that makes these people vulnerable, then it's useless. So we must be able to have a change in how we see these dynamics. Why these people, why our brothers and sisters are not being properly compensated? Why they do not receive the proper PPE? Because maybe what? Because they are considered just uh, marginalized. They are the least among the people who needs to receive them. So that kind of dynamics must change, and the church must be able to call that to point on that and advocate for change on that.
Yes, you both leave us in Mexican as well with a huge challenge for our churches and a call to action. And we thank the three of us, Mexicans, Alex and Pastor Soriano, for joining us this webinar. Uh, the people who are looking at the webinar also are sending you words of support, of hope, appreciation for the hard work you are doing at the front lines and how we need to take into account all these different challenges of safety, of security, of well-being that frontliners are having and dealing with now. And then that the church can be also not only talks about the spiritual healing, but also advocates for more strategies that could bring a support to people from the front lines. Even in these uncertain times, we can also find a message of hope that the church is called to do and to act for it as salt, as light, and the Nazareth manifesto that we can see in bringing news to the poor, healing the sick, and that's also a call we're having amidst this pandemic. We thank you for the participation of the three of you, and we are going to have a small prayer in the next video. Well, again, thank you, Pastor Alex and Mrs. Deacon, for your interventions today and to bring your own perspectives from the front lines to the center of these conversations. Um, Thank you, everyone, for participating in today's webinar, People at the Front Lines, the Gift of Life. And we hope to see you next week at the same time. In the series we're having with the World Council of Churches perspective from the margins. And this, yeah, we invite you to be here next Thursday. Have a good day, rest of the day, everyone, and see you next time.